Hello everyone, I am Dr. Kamal Jhamnani, Consultant Dermatologist practicing in Hyderabad at Abhirit Specialty Clinic. Since this is winter season and we come across a lot of children suffering with atopic dermatitis and atopic eczema as it is referred to. So I thought I will put in my few insights about the do's and don'ts for a child suffering with atopic dermatitis, because it's not only the child, the entire family goes through the suffering, because the child will not get adequate sleep, so do the parents, and then it's like the stress, and that just aggravates it. So there are very simple do's and don'ts which you can do during the winter season so as to comfort the child with atopic dermatitis. Of course, along with the ongoing treatment, like atopic dermatitis does require active interventions like the mild active steroid creams and antibacterial, which your dermatologist will definitely suggest you. Another important thing, an important treatment linked to prevent recurrences of atopic dermatitis is inadequate usage of moisturizers. Now, I would consider that as the backbone of any kid or anyone suffering with atopic dermatitis. Use moisturizer very regularly, and you will be blessed with the lesions healing well and the child not suffering repeated episodes of it. So moisturizers, it's not each and any moisturizer. Of course, any moisturizer will help, but adequate usage of moisturizers containing ceramides go a long way in controlling atopic dermatitis. And it's important to apply the moisturizer very quickly, immediately after bath. Ideally, it is said within 2 minutes after towel drying, because the body is still damp and moist, and applying the moisturizer on that kind of seals the moisture inside. Of course, repeat applications are recommended during the day, but this morning application is very important, because that forms a protective coating on the skin. And then all through the day, taking care, and not like whenever you are, if you are someone who washes hands or washes this area very frequently, it is a good procedure to maybe keep the moisturizer handy and keep applying it. But morning application definitely important. And moisturizer goes a long way. We call the moisturizers as steroid sparing agents. So if you are very regular with the moisturizer, you will be spared from the usage of too many active steroid based creams. So moisturizer is important. Another thing is atopic dermatitis individuals should avoid using very harsh soaps or very harsh cosmetics, something which might have too much of fragrance. That should be avoided. Even bathing should be with lukewarm water. Avoid very hot water, because you must have observed it's a common practice. Even a simple basic thing, like you have a very oily utensil, you soak it in hot water to remove the oil. So same thing happens when you have a bath with very hot water. It kind of removes all the essential oils from your body, and that's aggravation for atopic dermatitis again. So a soft body wash or a soap which doesn't have too much of fragrance, lukewarm water, very short baths, don't spend too much of time in water, and immediately after drying with a soft towel, apply the moisturizer. So this procedure goes a long way in preventing recurrent episodes and saves the use of unnecessary active medications. Thank you.